Hey everyone, Karibu Tena to the channel. Today we're diving into an updated list of the top 10 deadliest ophthalmologic disorders worldwide, ranked from number 10 up to number 1. When we say deadliest, we're not just talking about how fast these conditions can lead to death. We're also looking at how they cause permanent vision loss and serious complications that can't be reversed. These diseases impact millions, so let's go beyond the stats and really understand their toll. Grab your notes, and let's get started. Number 10 is uncorrected refractive errors, like myopia, hyperopia, and astigmatism. Over 2.2 billion people globally have these conditions, which cause blurry vision. They may seem mild, but uncorrected refractive errors can impact quality of life by limiting education and job opportunities, especially in places like rural India and sub-Saharan Africa, where access to glasses is limited. Also, uncorrected myopia can increase the risk of complications like retinal detachment, which can lead to permanent blindness. Corrective lenses can prevent these complications and preserve sight for millions. Simple interventions here can be life-changing. Number 9 is uveitis, an inflammation of the middle layer of the eye, known as the uvea. Uveitis is often caused by infections, autoimmune diseases, or injuries, and it's one of the leading causes of visual impairment in young adults, particularly those with autoimmune diseases like rheumatoid arthritis. Without early treatment, uveitis can lead to cataracts, glaucoma, or retinal damage, each of which can lead to permanent blindness. Early intervention and regular monitoring can really make a difference. Coming in at number 8 is Onchocerciasis, or river blindness. This parasitic disease is spread by infected black flies that mostly bite during the day near fast-moving rivers. It's common in rural areas of sub-Saharan Africa and parts of Latin America. The infection causes intense itching, skin damage, and eventually blindness, if not treated. River blindness is especially a problem in rural Africa, where people live close to black fly breeding grounds. Thankfully, treatment with ivermectin has shown great success, but many still lack access. Reference WHO Onchocerciasis Fact Sheet 2021. At number 7 are corneal opacities. Corneal opacities occur when the cornea, or the clear outer layer of the eye, becomes scarred or cloudy due to infections, trauma, or even vitamin A deficiency. This condition is a big issue in regions with limited eye care services, like parts of Southeast Asia and sub-Saharan Africa. If treated early with antibiotics or corneal transplants, the condition can often be reversed. But without treatment, it can lead to permanent blindness. Reference WHO Vision 2020 Initiative. Number 6 is Retinopathy of Prematurity, or ROP. ROP mostly affects premature infants born before 32 weeks, when their retinal blood vessels are still developing. This condition occurs when abnormal blood vessels form in the retina, which can eventually lead to retinal detachment and blindness. More preterm babies are surviving thanks to better neonatal care, but that means more babies are also at risk for ROP. Regular screening and laser treatments can save vision, but families need access to these services. Reference National Eye Institute. Trachoma is number 5. This bacterial infection is caused by Chlamydia trachomatis and is often spread through poor hygiene and close contact with infected individuals. Repeated infections can scar the eyelids, causing the eyelashes to scratch the cornea and eventually leading to blindness. Trachoma is still widespread in rural areas of Africa, the Middle East, and Asia. The safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvement has helped reduce cases, but millions still suffer, especially in areas where sanitation and healthcare are lacking. Reference WHO Trachoma Report 2020. We're halfway through. Here's a question for you. Which eye condition do you think is the most common in low-resource areas? Drop your guess in the comments, and let's see who gets it right. At number 4 is diabetic retinopathy. With diabetes rates rising globally, diabetic retinopathy has become one of the leading causes of blindness. High blood sugar damages blood vessels in the retina, leading to bleeding, retinal detachment, and eventually blindness. An estimated 1 in 3 people with diabetes develops retinopathy. Regular eye exams and good blood sugar control are crucial here. Early detection and treatments like laser therapy can prevent vision loss. Reference: International Diabetes Federation and Lancet study. Now, in third place is age-related macular degeneration, or AMD. AMD affects the macula, the central part of the retina, leading to a loss of central vision. It's most common in people over 50 and is a leading cause of blindness in high-income countries. While there's no cure, treatments like anti-VEGF injections can slow the progression. Early detection is crucial here, as AMD can cause damage before symptoms even appear. Coming in at number 2 is glaucoma, often called the silent thief of sight. Glaucoma damages the optic nerve, typically due to high eye pressure. Unfortunately, it progresses without symptoms, and once vision is lost, it can't be recovered. That's why regular eye exams, especially after 40, are essential to detect glaucoma early and help prevent vision loss. And finally, at number 1, cataracts. Cataracts are the world's leading cause of blindness, especially in older adults. They develop when the lens of the eye becomes cloudy, obstructing vision. While cataracts can often be treated with surgery, lack of access in low-resource areas leaves millions of people blind. Risk factors include aging, trauma, smoking, and prolonged UV exposure. As we've seen, eye diseases impact millions, especially in underserved communities. Many of these conditions are preventable or treatable with early intervention and access to healthcare. Let's raise awareness, share this video, subscribe for more updates, and help spread the message on eye health. Tunashukuru sana kwa kutazama. Until next time, take care of your eyes.